A very warm welcome to everyone here for what is a very important event in the TassCOSS Community Sector Election Campaign. Our influence on the parties to try and make sure that we achieve good things with the community sector from the party that forms government after the next election. I'd like to start by acknowledging and paying respect to members of the Tasmanian Aboriginal community and their elders past and present as the traditional owners and continuing custodians of the land on which we're meeting. And a special acknowledgement and welcome to our three invited speakers this morning. Beck White, Minister for Human Services, Jackie Petrusma, Liberal Spokesperson for Human Services, Cassie O'Connor, Green Spokesperson for Human Services, are our special speakers this morning. TassCOSS and a number of key supporters, including the community sector peak organisations, are very actively involved in this state election campaign. We see it as the culmination of our advocacy over the past 4 years. Those issues have our community at their heart, and our campaign is calling for policy commitments that will boost individual and community resilience, social and economic participation, and improve the health and well-being of all Tasmanians. Our campaign has a number of elements and activities, including a comprehensive call to the parties document, which sets out some vital matters to be addressed by the next Tasmanian government around education, employment, affordable housing, affordable essentials, promoting the state's interests with the Commonwealth Government, provision of accessible affordable transport, and adequate support to ensure that we have an effective community services sector. Now, I'll now introduce our three speakers, who each have 10 minutes to set out their party's vision for the community and plans for the sector that supports it. And our first presentation will be from the Minister, Beck White.
Good morning, everybody, and thank you very much for having me. It's a real pleasure to be able to join you as Minister for Human Services. I'm very pleased to be able to stand before you here today and talk to you about Labor's achievements in government and our vision for the future here in Tasmania. I would like to pay my regards to the former Minister, Cassie O'Connor, who joins us here. The work that Cassie did in this portfolio and the work that many ministers prior to me did has shaped the way that we present to you our policies today. So thank you for your work, thank you to the work also of the staff in the office and the work of the officers in the department. They've been a tremendous help to me, and I'm very, very thankful for their guidance. I don't think it's any surprise to anyone here to understand that Labor's vision for Tasmania is shaped very much around the focus on people and providing opportunities and equal opportunities for all Tasmanians to participate fully in the Tasmanian community. Jobs, people and opportunities have been key themes of this government over the past 4 years. And the focus on people continues to be a major component of our policy driving forward. Since we were elected in 1998, our focus has been on giving all Tasmanians the opportunity to build a better life and contribute to their community, and that will continue to be our focus. First, I would like to start by touching on the state budget position. In all these election forums, I think it's important, regardless of the portfolio of the issues being discussed, that we are aware of the current budget position and that we have an idea about what can be realistically achieved and where we still need to keep working together to find solutions. The Premier is already on the record saying the state's challenging budget situation highlights a need for modest election spending. And I will be upfront with you all today and let you know that I do not have any big policy announcements to make to you. But Labor does have announcements and commitments in the human services portfolio area that we will be making during this campaign, with the first of them to be occurring next week. However, the Labor Party spending commitments will be modest in comparison to what we've already been offered by the Liberal Party. And I can give you my word that this means that you have certainty that if the Labor government is re-elected, we will be able to deliver on the commitments that we have made to this sector. The Liberals, on the other hand, need to find $500 million in savings to fund the commitments they have made to date. We've had no details about where these savings will be made, and it means all government-funded services remain under threat, the very services you provide to the community. I hope that my parliamentary colleague, Jackie Petrusma, Shadow Minister for Human Service, can provide you some clarity today on where these savings will come from, because already the CPSU, the union representing community sector workers, and the public services calculated the total number of jobs that would be cut from the public service to fund the policy so far announced by the Liberals will be in excess of 1,200. A loss of 1,200 jobs will put greater pressure on your organisations and the services that you provide. The reality is that Tasmania's budget condition continues to be impacted by factors outside our control. Obviously, reduced GST receipts and the impact of the federal government's decision around the carbon price will have negative consequences for Tasmania's budget. On a small state budget like ours, these losses have a real impact on the ability of the government to spend on new and increased services. I'd like to now touch on the points that TassCOSS have raised in their paper and make sure that you understand clearly how Labor intends to deliver on these commitments. One of the key upsides, I suppose you'd say, from the downturn in the budget has been improved engagement and relationship building across the sector. We've seen the challenges and we faced them together, and we have delivered solutions and real outcomes for all Tasmanians. We have seen an environment where there has been a demand for growth in services and the cost of the service delivery is increasing. But we've both recognised and embraced the need to work together to be as efficient as possible with the resources we have available. Labor recognises the complementary roles that the government and the community sector play and the importance that our relationship has in the delivery of safe, efficient and high quality services. We've strengthened our relationship with the community sector through the partnership agreement between the sector, DHHS and DPAC, and the partnership agreement has captured and formalised our shared vision, values and purposes and sets out a foundation for continuing collaborative relationships. The Labor government established the Peace Network and Government Strategic Forum to oversee the implementation of the partnership agreement, and we will continue to work with you on the mutual priorities identified in this forum. We will also continue to work with the community sector on the other challenges, including ways of measuring the social outcomes we've achieved in order to ensure that we are doing the most we can to make a difference in the lives of Tasmanians. I would like to also touch on the issue of indexation. It's a matter that's been represented to government well by TassCOSS and other community service organisations. And we've been working with TassCOSS and the Community Sector Peace Network on exploring models to meet the community sector's core costs. This work is very welcome, and I believe it may assist government in addressing the challenges we both face in this tight environment. I acknowledge that the issue of funding and indexation has caused uncertainty in the sector over the past few years, and I would like to thank you for working with us. We've all worked with tightened budget situations, and I look forward to working with you in a time when revenues increase and we can see those revenue increases flow onto the community sector. We do find though when things are tight that innovation improves and increases, and the government's finances have shown us that even in times when we face some long-running problems, we can find solutions together. We have demonstrated our commitment to innovative measures to improve opportunities for Tasmanians through investment in child and family centres and our cost of living strategy. With the shared service model of child and family centres and our service hubs, we've been able to break down the silos that exist in government service delivery, provide opportunities to improve education and health outcomes for our youngest Tasmanians. And of course, through our cost of living strategy that I was proud to champion with the Premier as the Parliamentary Secretary of Cost of Living at that stage, we have seen the development of the first of its kind strategy for our nation. And we've seen other states now take on this same challenge. The cost of living strategy was developed in consultation with the community sector, and I thank you for the work that you did with us at that time to identify the priority areas for government to address some of the most pressing cost of living needs in our state. We've developed programs that address food security, affordability, energy efficiency programs, emergency relief, and programs to build capacity in our Tasmanians with reforms and also reforms of concessions and water and electricity tariffs. As a result of this consultation, we were able to fund a range of budget initiatives to ease the cost of living pressures on those in need. And these programs have been successful and delivered really meaningful outcomes for Tasmanians. They've given us great evidence about what works and what kinds of programs Labor can look to fund in the future budget. Developing the cost of living initiatives is a great example of how Labor wants to continue to work with the community sector and how side by side we can find real solutions to Tasmania's problems. We listen to you and we look forward to continuing to work with you to achieve the same great outcomes. Now, I acknowledge that TassCOSS has suggested that a state policy on affordable housing be developed, but at this stage Labor believes that we do not need a state policy on housing because of the great work we've already achieved through significant reforms in the national partnership process. The implementation of these reforms is in the early stages, and both government and the community sector have heavily invested in terms of time, money and human resources in developing these reforms, and And I believe we must focus on ensuring these are properly implemented first for the benefit of the people that we signed to help. Currently, like all states and territories, we are waiting to hear what will be included in the future national partnership agreements on housing and homelessness. And once we know the details of the future NPAs, we'll be able to make decisions around state funding commitments in these areas. These are very important national partnership reforms, and I hope today that our Liberal member for Franklin, the Shadow Minister for Human Services, might be able to indicate to us what lobbying she is doing to the federal Liberal government to ensure this money continues to flow for these important reforms here in Tasmania. Labor has driven some significant achievements in the area of affordable housing during the past term of government, and we've certainly remained very committed to looking after those in our community who are doing it tough and ensuring that all Tasmanians have access to safe, affordable and appropriate housing. Important reforms such as Better Housing Futures and Housing Connect have seen the government working even closer with the not-for-profit sector, providing better services to Tasmanians who require public housing. We remain strongly committed to these reforms and the successful implementation of Better Housing Futures and Housing Connect. Labor has also been a very strong supporter of the National Disability Insurance Scheme, and we know that the launch is happening right here in Tasmania is having a transformative impact on the lives of those Tasmanians aged between 15 and 24. As Minister for Human Services, I've had the privilege to visit some of the providers who provide opportunities for those Tasmanians to participate more fully in our community. 1 minute. As Minister, I would like to see further funding, of course, aimed at this particular sector of our community because of the important work that's being done. And I give you my word that I'll continue to lobby very much in the budget process for more funding to be delivered for disability services. One key component, of course, of providing disability services is the NDIS. Tasmanian Labor has made it very clear that we support the full rollout of the scheme and we continue to lobby the federal Liberal government to ensure this occurs. It's certainly something that concerns me when it's referred to as the trial. It's the launch and we want to see it continue fully. I've touched on some of the programs which developed in the cost of living portfolio already, so I might skip over that and talk about equity in the community sector, particularly with respect to the ERO. We've already committed $58.3 million in the forward estimates to 2016-17 to meet our share of the cost of these initiatives. We've also lobbied strongly to the Australian Government to increase their contribution to the Tasmanian sector, and we will continue to advocate for an Australian Government contribution that meets the fair share of the increase. We want to see the state's 9,000 community sector workers paid a level that reflects their commitment to the community and the challenging nature of their work. Providing extra funding reflects our ongoing support of those community sector organisations that fulfil such a vital role in our community. We look forward to continuing to work closely with the non-government organisations and peak bodies to see this commitment fully funded. In conclusion, Labor understands that to ensure all Tasmanians have an equal opportunity to build a better life and contribute to their community, we need to help remove the barriers that hold people back. Tasmania's strong and involved community sector is making a real difference to Tasmanians every day by removing those barriers. The community sector is an integral component of the community service system in Tasmania, and we believe it's important that there's a positive, productive relationship between the sector and government. I thank TassCOSS for the work they've put into their state election campaign policy briefs, and I hope to have the opportunity to work on solutions to these issues in partnership with you as Minister after the election. Thank you for your time.
Good morning, everybody. It's fantastic to see so many friendly faces in the room, and I just have to say that thank you. For over the last 4 years, it has been really great to have had the opportunity to speak to you, to work with you, but also to learn from you. And no matter what happens on March the 15th, no matter if I'm not Minister or Shadow Minister or not even in the role, I very much want to maintain the friendships and the relationships that we've built up over that last 4 years, because every day I'm just gobsmacked and amazed at just the amount of work that you do out there in the community. And if I'm not elected, I just want to actually continue on working in the community sector organisations. I came from aged care environment, and I understand the issues of paperwork and all the issues that you face on a daily basis about having to chase for funding. So I thank you for the work that you do, and as I said, no matter what happens on March the 15th, I look forward to actually maintaining some form of relationship with you in the future. Now, as you are all very well aware, about a third of all Tasmanians, 32.3% of the population, rely on Commonwealth benefits as their main source of income, compared to 22.6% nationally. Back in 2005, the figure in Tasmania was 31.5%, and the national proportion was 26.1%. Therefore, the proportion of people reliant on welfare has hardly budged. But the gap between Tasmania and the rest of the country is getting wider. And it's just not welfare where we have this problem, as the gulf between Tasmania and the rest of the country is similar when you look at unemployment rates, educational outcomes, access to health services, population growth, jobs creation, and economic growth. We know, and I think all of us in this room know, that we cannot allow this to continue to go on. We also have in Tasmania the problem of stigmatisation, especially of people who do live in entrenched poverty. And there's the belief that people don't want to get out of welfare. Well, from my own personal experience, I don't believe for a second that people choose to live in poverty and want to stay there. I was brought up in a single parent household. For 11 years I was a single mum myself. I've lived on Centrelink. I understand the battles it is to be both mum and dad, to be the poorest kid in the street. But I was lucky, because even though my mum was a single mum, we had my grandparents, helped us out. When I had my daughter, my mum provided a roof over my head. And she looked after my daughter while I finished off my nursing training and while I went to uni, did a Bachelor of Commerce and a Bachelor of Education. So through her support, she gave me the opportunity to get a good job and then to keep on going up and get even better jobs. Now, what I've learned from my own personal experience, but from speaking to you all out there in the sector and just from speaking to the people that come into my office, is that people living in disadvantage, it can be so much on, oppression that they feel in reality or not, that they honestly see no way out. And I can see that the difference between myself and them is that I had that help and support, which you give them all the time. But if I hadn't have had that help and support, I would not be standing here today as a Member of Parliament. And so over the last 4 years especially, I've been asking myself the questions: are we providing help in the right way to shift the entrenched levels of disadvantage in this state? And is it time for some new thinking on an old problem? So last year, when those buzzwords, collective impact, were starting to get out there, I became very excited about it. I started reading about it, because I truly believe that if we're going to affect social change, it is through collective impact, where government and the community sector work hand in hand to stop doing the welfare approach, but to do a person-centred, hands-up approach. Because it's only through working collectively with a shared agenda that I believe that we'll make a difference in the lives of those who are disadvantaged. However, the problem that I see in Tasmania at the moment is that our support systems are not able to take a 360-degree holistic view of a person or their family, and it is all geared up and forced to look at a person as bits and pieces. It's like getting a person and pretending they're a pie, and you chop them up into different pieces, and we'll give one piece of the pie to one organisation, another piece of them to another organisation. And I have met families, I've met individuals who have had up to 10 different caseworkers, but I've met one family who had 22 different caseworkers going in and out of their lives. Now, I've got a busy household. I've got 4 kids and 2 grandkids who basically live at our house, I cannot imagine having to try and live my life, program my life around having 22 different caseworkers who are having input into my family, if it's mental health issues or homelessness or housing, etc. And no wonder people disengage. No wonder they think it's too hard. No wonder they stay where they are, because it'd be just impossible to actually see the light of day, but also it'd be a full-time job just having to try and maintain contact with all those different people. So people themselves are telling me that the system at the moment is just too difficult to navigate. And that is exactly what Professor Peter Shergold found when looking at service sector reform in Victoria. Because the fact is that the community sector has become burdened with more and more regulation, along with prescriptive and rigid program-based funding that has put a dampener on you, the sector, to be able to be innovative and to offer flexible solutions. So I believe that we do need to work differently. We need to work together in a true partnership with the government and the community sector, focused on joined up, integrated and coordinated support systems rather than the isolated silos that we have operating at the moment. That way we can have true collective impact, because we can use our combined resources better to address the needs of individuals, families and their communities. So it means together having a clear picture of the shared outcomes that we want to achieve, how to measure them, and what are the best tools we will need to do that, without adding any extra compliance reporting on you, the sector. For people who are disadvantaged and who have complex needs, it needs a person-centred, hand-up approach that provides the right supports to help them to take the next steps, even small incremental ones to get them out of disadvantage, while at the same time teaching resilience over reliance. What I also believe is needed is a single shared entry point and assessment for both government and community delivered services, so that individuals and families need to tell their story only once. As well, to have a lead worker or a lead caseworker for complex cases, dedicated to building a network of support around individuals and families for all their needs, so that they don't have to navigate the maze of services on their own. So what we see is that a client will come to one entry point, there'll be one assessment done, they'll be assigned one lead caseworker, and then with different problems you'll bring in the specialist support that you need. But it'll allow organisations, instead of having to go for different grants to deliver mental health services or housing services or family support services, you'll be giving clients and saying you can now offer a 360-degree wraparound service around that person. It'll save you a lot of paperwork, a lot of compliance costs, that allows your workers to also have a better sense of that I'm actually helping somebody. I'm not just helping their mental health problem, I'm helping their housing problem, I'm doing their family support work, but bringing in the specialist services as required by referring out. International evidence also points to certain steps needed to address deep-rooted complex social problems. They include a common agenda, a coordinated approach, open communication and oversight by a backbone organisation that measures and monitors. And so I'm pleased today to announce that if we win government, we'll be investing an additional $250,000 into TassCOSS so that they can develop the new shared tools to oversee, measure and monitor our new approach. Because we believe it's very important that government works with you, the sector, and that TassCOSS as your peak organisation is the best one to represent your views with government. So we'll also be inviting TassCOSS to be a key part of a high-level advisory team to begin the changes that I've outlined, because it's not going to happen overnight. We're talking it could take a long time, but we want you, the sector, to be working with TassCOSS so that we can together work towards this outcome of having truly integrated services. Now, ladies and gentlemen, the Liberals today have released a quite vast document. We've got quite a few pages for the community sector. It will be up on the website later today. There's 10 pages of initiatives, for example, the $9 million that we've already committed to help with your operational funding towards indexation. It also includes $250,000 towards an affordable housing strategy, because we believe that we need to have a plan to drive growth and supply in the housing sector. That'll also review things like home shares, streets ahead, and it will also examine about perhaps handing over a third of title to community housing organisations. It also contains our other initiatives that we've already announced over the last few weeks, like $53 million to create a job-ready generation, to our jobs plan to create 5,000 extra jobs. And it includes also our money for disability funding. In fact, there's pages and pages of it. That's only the announcements up to this date. We've got plenty more to come in regards to children, disability, youth justice over the next few weeks as well. So I encourage you to keep an eye on our website and to keep on looking at it, because every day there will be more announcements to come. So as I said, this document is only up until this morning. There's more to come. So once again, I just want to say the Liberals are ready to govern. We believe that we've served our apprenticeship. We believe it's also time for Tassie to have a fresh approach, because we can't keep on doing the same things time and time again and expecting different results, because we believe it's through taking a different approach that we can actually make Tassie the great place to live and work and to raise a family. Thank you.
Good morning, everyone. It's lovely to be here and to see so many familiar and friendly faces. Before I begin today, I wish to pay my respects to Tasmania's first people, the Palawa Pakanama. To Aboriginal elders past and present, I pay my deepest respects, and I acknowledge the Palawa Pakanama as the original owners and custodians of this beautiful island, Lutruwita, Tasmania. I think it's a statement of bald fact to say that without our community sector, Tasmania would be socially, utterly destitute. Without you, either government would deliver these services, and we've had experience of that in the past, and I don't think it's done as effectively or as efficiently, or disadvantaged people would live without hope or support. Damaged and broken lives would never be repaired. Without TassCOSS, the voice of disadvantaged Tasmanians would be much harder to hear, and the voice of the sector itself would be fragmented, less strategically focused. Tasmania's community sector is one of the three most important pieces of social infrastructure this state has, along with our people, of course, and the public sector. It's the network of small, medium and large government-funded community service providers in Tasmania that works at the front line of disadvantage in housing and homelessness, disability, child and family support, domestic and family violence, crisis intervention and mental health. What I learned about the sector in my time as Minister, and I have to say it was a great privilege to be your Minister, and thank you so much for teaching me so much and for being there, telling me where we were going wrong when we needed to be told. It was just a delight to be your Minister. What I learned about you in that time is that the sector is incredibly dedicated, very resilient because you've had to be, often innovative by necessity, has an intimate knowledge of Tasmania's social landscape, a pretty good capacity to work together, certainly better than in other states, vast corporate knowledge, and a strong capacity to connect with policymakers to effect positive change. Our collective goal here is to empower Tasmanians living in social and economic disadvantage, to give them the support and the personal tools they need to create their own future, to bring down their cost of living through initiatives like the 9,500 energy efficiency upgrades that we delivered in this term of government to low-income households, community groups and small business. And I've spoken to people who live in public housing and in fact in private rentals who are saving at least $300 a year on their power bills, some of them saving $200 to $300 a quarter on their power bills. And we cannot underestimate the power of bringing down the cost of living for people through energy efficiency, because not only does it make their homes healthier, it takes some stress out of their lives when the power bill arrives. And the Greens have committed, and I know it's part of TassCOSS's election priority statement, to continuing that energy efficiency work. It's absolutely got to be core to government business because it is improving the health and well-being of disadvantaged Tasmanians. And of course, we also need to continue to build affordable and energy efficient housing in Tasmania. Over the past 4 years, around 1,600 new homes have been built, affordable homes for disadvantaged Tasmanians, all of them at least 6-star energy efficiency, some of them around 7.5-star energy efficiency. We've got the fantastic Hopkins Street development just down the road, Brisbane Street in the heart of the city. We've built Time House up in Launceston, which is providing affordable, secure housing with supports wrapped around it for young people from disadvantaged backgrounds. We're going to see an awesome development in North Hobart when Trinity Hill is built. We'll see 46 homes for young Tasmanians, 16 of them for Tasmanians living with a disability, with education and training facilities on site. And of course, one of the most marvellous sights I see driving up the Brooker is the refurbishment of a place once known as Stainforth Court, which is now Queen's Walk. Amazing, 6, 7-star energy efficiency. Really, it's changed people's lives, and that refurbishment had people lining up to move back into a place where once people didn't want to live, and we were in fact having trouble filling those units. So this is all about providing disadvantaged Tasmanians with secure, affordable housing, because we know that is a foundation of every other aspect of their health and well-being, access to education, training and employment, and also that social connectivity. And ultimately what we need to do here, of course, is to create communities, not the old housing developments of the past which entrench disadvantage, but communities which are all about people. We also, of course, need to ensure our education system is a key part of breaking entrenched cycles of disadvantage. And that's why launching into learning, now engaging parents and children in all public schools across Tasmania, is so important. And what they've found is that children who take part in launching into learning spend 2 more days on average at school each year than those children who haven't taken part. And this is key to changing a culture around education in Tasmania, because it involves parents every step of the way, and launching into learning is critical to breaking that cycle of disadvantage here in Tasmania, as of course is the Gonski Fairer funding model. This state government committed absolutely and wholly to the full rollout of Gonski, and we've seen some equivocation of course, from the Abbott government around Gonski. But why Gonski is so important is that it is funding that is attached to individual students. It is funding that will increase where a student is experiencing disadvantage. And again, this is part of breaking a cycle here in Tasmania, because education is key to a successful future, and it's absolutely critical to tackling poverty. The Greens, of course, recognise that access to affordable housing, training and employment opportunities, transport, essential services and education are key planks of TassCOSS's election priority statement, and I'm sure we will discuss those more during this forum. I just want to talk briefly about the economic opportunities that are available to Tasmania in the future. They don't come from a pulpit. They come from a 21st century approach to economic development. They come from tourism, agriculture, fine food and wine, ICT, and of course we'll see some major growth in Tasmania over the next decade in aged and disability care. And these are the jobs that we can provide to disadvantaged Tasmanians, Tasmanians living in rural and regional areas in a diversified economy. And what we need to make sure that we're doing is providing the skills development opportunities, particularly for young Tasmanians, to move into those sectors, and I think particularly into the aged and disability care sector, because I think that will be a massive area of jobs growth in the future. Over the past 4 years, I also learned that the sector is very lean, that there are constant viability challenges caused by a finite funding pool, coupled with an increased demand for services. I've spoken to so many stressed out CEOs over the journey, and I always wished that I could give you more. The harsh reality of the next 4 years for the sector, working with whoever is in government, is that I can only see these pressures increasing. I suspect you're in for a very rough ride, and that you'll need to find strength in each other and your collective voice and capacity to ride out the rough times ahead. These are the challenges. Diminished funding for community services across the country, possibly in every area except disability support, and that is coupled with an increased demand for and complexity of need. A federal government that thinks we live in an economy, not a society. A government that is hostile to the plight of the poor, that soon after being elected cut the superannuation reforms put in place by Labor to support low-income workers. A government that has commissioned the ominous Commission of Audit to examine every space for savings. A government that still makes disturbingly equivocal noises about the NDIS. A government that also continues to squiggle around on Gonski. A government that, despite repeated requests for reassurance, still has said nothing of substance on the future of the National Partnership Agreement on Homelessness or the National Affordable Housing Agreement. And let me tell you, you all know this, that if the NPAR falls over because funding runs out on the 1st of July this year, the impact on our specialist homelessness services and supports in Tasmania will be devastating and profound. And this is why it's so important that we do all work together to make sure that the Abbott government delivers on the NPAR and the NAHA. It's a government that's always been strangely silent. It was in opposition on the long overdue and much needed Fair Work Australia community sector pay increase and what that would mean for funding from both state and federal governments. Many of these ongoing viability issues will only be sustainably resolved, I think, through tax reform at a national level, but I can't see this government having the heart or the will to be honest with the Australian people about the need to increase the tax take from those who can most afford to contribute extra in order to properly fund core public and community services. There's another major challenge, one more minute. The other major challenge for the whole sector is the rise of the for-profit sector. They're coming. There's an organisation many of you will have heard of, it's called SERCO. SERCO runs detention centres and prisons. SERCO also does bulk human services contracts for government. Now, if an organisation like SERCO had its eye on Tasmania, the impact on people here, I think, would be profoundly negative because you'd lose that intimacy and the connection that the community sector has with people. So my very, very strong advice to you, and I know I said this to you over and over the past 4 years, is solidarity is strength. Work together, work through the PEATS network, use the partnership agreement with government to strengthen that foundation. Find every single possibility, and I know you're good at this, for efficiencies in your operations and resource sharing, because it is by working together that you will prevent the takeover of human services by an organisation like SERCO. I do believe, I agree with Jackie, that we will ultimately one day have a single human services gateway here in Tasmania. And why wouldn't we use the Housing Connect model, where we put the key players into a room and we said, rather than make you beat each other up in a tender process, work it out. Work it out and come up with a workable model. And I think that that's something that the sector is so capable of doing here in Tasmania. So the Greens are with you all the way because we believe in you and we believe in the people that you support. Thank you so much for the opportunity to speak here today. And thank you everyone for everything over the past 4 years and all the work that you do for Tasmanians who need you.
Okay, well, now we're going to move straight to question time. This is your opportunity to talk to the Minister and the party spokespersons about not only what they've talked about here this morning, about their vision, about the things that their party will do in government, but also about the particular issues in your sector and your organisation and how they might relate to those.
My question was to Jackie. In Victoria, you spoke about the Shergold report. My question is, does that outline the structure for community services in Tasmania if the Liberals are in government? And does that mean that we'll also see large-scale re-tendering of entire sectors of the community sector, as is happening in Victoria at present with the mental health sector?
Thanks for the question, Darren. As I said, that this is not something that's going to happen overnight, and we also need to have a Tassie-based model. I don't believe for an instant that what is happening in Victoria is necessarily the way that we need to go in Tasmania, and that's why we very much want to set up a high-level advisory board with TassCOSS on the board to actually represent, your issues and concerns, because Tassie's totally different with the things that we're facing as a state are different issues to what Victoria's facing as a state. So we can't just pick up a model from somewhere else and just replicate it here. But the advantage we have is that we can look at what's happening in Queensland, Victoria, but also overseas in regards to the use of collective impact to actually put together the best sort of model. And that's why we want TassCOSS, the $250,000 is to go to them to help us set up the tools that will help measure and set the outcomes. This is not going to be this is probably a couple of years down the track before we'll even be able to get to even thinking about tendering and everything else. So it's and the plan is actually to make it easier for organisations to tender. Instead of having to tender for different separate services, they'll just be able to tender for a client group as a whole. So it's we'll be working with you the whole way through. It's not something that's going to happen overnight, not by a long shot.
Look, thanks very much for the opportunity. Tim Goulay, Chief Executive Officer or Executive Director of Centacare and Centacare Evolved Housing, and also a Director of TassCOSS. Can I start by thanking each of the panellists, the Minister, the former Minister and the Shadow Minister for their commitment to our sector, which I believe is tangible and unequivocal, and we are certainly speaking from my own view, we really appreciate. Thank you for that and for your presentations. I've got two questions, if I might, Chair. One is an education-related question, and one is about a housing aspect. So the first one is, and I think generally people would accept that research shows education holds the key to unlocking disadvantage and lack of participation. And in Tasmania, unfortunately, we have intergenerational disadvantage and we have intergenerational poor performance in relation to key stats in education. They are poor participation, low levels of achievement and very low retention. I think it was Jackie that said it's probably time for new thinking on an old problem. Unfortunately, as I say, this problem in education and the issues around it are intergenerational, they've been around for decades. I would like to hear from each of the major parties what their initiatives or what innovative ideas, what new thinking on the old problem they might have to address this, because it is a key issue for TassCOSS, it's a key issue, should be a key issue for Tasmanians, and whilst much has been spoken about in the past, we cannot let it go unchanged. Second question, in relation to housing, former Minister recognised the problem of the NAPA and NAHA agreements, which the future of which are very uncertain, and there's people in high needs and at high risk of homelessness that depend on the services provided through those programs. They are jointly funded by Commonwealth and State Government. I would like to hear again from each of the major parties what their plans are and their commitment to continue to support the programs that are funded by NAPA and NAHA, National Programs Against Homelessness. Thank you.
To answer your last question first, Labor Party remains entirely committed to funding for the NAHA and obviously the National Partnership Agreement on homelessness. We have written to the relevant federal ministers asking for them to provide us advice around when we can expect some response. Of course, there's a transition agreement for the NAPA that ends on the 31st of June this year. We've yet to receive any information from them that's reassuring, and a national partnership agreement on housing is in the same bracket. Obviously, that's an agreement until 2016, but the funding ends at the end of this financial year. We remain committed to the full implementation of those particular programs. We are obviously very uncertain at this stage as to what the Liberal federal government's commitment is, and I believe there's a meeting in Western Australia today with some of our officers who are trying to work through that particular problem. It is a huge issue for us and will have a devastating impact on our budget, so it's one of our priorities, absolutely. With respect to education, we have made some education announcements already this election in terms of Labor's policy commitments. We've shown and demonstrated our clear commitment to investing in the early years through investment in launching into learning, our child and family centres, raising the bar, closing the gap. We announced additional funding to improve opportunities to engage vulnerable children, particularly in the early years, and to improve transition pathways from grades 6 to 7. We understand that it's those early years that are critical. If you're going to improve retention at school, you need to engage with vulnerable families early, and not just the children, but with the families and involving them in the school environment. So we've provided additional funding, that will cover additional 22 teachers, plus across the primary and secondary years, plus additional funding to our child and family centres and launching into learning programs to improve those connections, to help identify those vulnerable families and engage them in education earlier. Responding at year 11 and 12 is too late. It doesn't have the desired income of improving retention at all. You need to respond in the early years if you're going to make a difference to that intergenerational disadvantage and disengagement from education that we spoke about.
Thank you for the question, and I think it's very important to remember with NAPA and AHA that it was actually the previous Labor government that terminated NAPA funding beyond 30th of June 2014 and actually did not provide for homelessness funding in the forward estimates. In fact, in August 2013, just before the election last year, the former Treasurer, the Honourable Chris Bowen, signed off on the pre-economic fiscal outlook and declared that all details of any government decision that has or could have material fiscal or economic implications was included in the outlook. So therefore the previous Labor government did not include any forward funding for those initiatives either. However, don't get me wrong, I totally agree with you that we need to make sure that that funding continues, and to that end, over the last 6 months I've actually been going around Australia meeting the ministerial counterparts in every other state, and I've had meetings with Kevin Andrews in the past, because if I am fortunate enough after March the 15th to be the Minister for Housing and Human Services, I want to be able to hit the ground running, but also to have those relationships established. So I know that I can pick up the phone and call the Minister for Housing in a different state and say, you know, together we need to work on this issue. I also think we need to work together to make sure that NRAS funding continues as well, because I think the two issues, NAPA and AHA and NRAS funding, they all are needed for this state, because we do not have enough houses. We know that there's over 2,000 people on the housing waiting list. There's a lot more people living in disadvantage. So I give you the commitment that if I do become the Minister after March the 15th, that I will lobby on your behalf to make sure that that funding does continue. But I just do want to make the point that actually did not end under a Liberal government. Now, in regards to education, I totally agree with you that our standards are unacceptable. You know, the fact that retention rates have dropped down from 70% in 2011 to 67.1% in 2012 is appalling, but also the fact is that only 43% of young Tasmanians complete Year 12 compared to the national average, and that is why we've announced over the last few months $53 million towards getting a job-ready generation of kids in this state. That over $53 million includes $45 million to extend high schools to Year 11 and 12. Because I know if I look at my electorate of Franklin, the Huon Valley, for example, kids going from Southport spend on average 1,200 hours a year travelling back and forth to college on a bus. And if you speak to like Robert's coaches, they'll say to you that they have 2 bus loads of kids coming up at Huonville at the start of the year. By week 3, it's dropped down. By the end of the first term, they're lucky if they might have 10 to 15 people on one bus. And the retention rate in the Huon Valley is about 19%. So we believe that Huonville, for example, or Smithton or other areas around the state need to be able to extend their high schools up to Year 12. Now, this does not mean that colleges will shut, because if we can get all kids in Year 11 and 12 engaged, that'll actually mean another 2,000 kids will be engaging in grade 11 and 12. So we still need our colleges, because we will not have the capacity for those extra 2,000 kids to go into the school system. But it also allows us to offer flexible learning options, because those kids can sometimes spend a day in the Huon Valley to attend school 11 and 12 down there, but if there's options that they need to do at a college environment, they might only need to come back and forth on the bus 1 or 2 days a week. So it's about offering, you know, that young person the best option to actually help them to stay engaged. Also, when we say Year 11 or 12, we're talking about Year 11 or 12 or equivalent, for example, Certificate 3 as well, because we acknowledge that some kids just, the academic pathway isn't for them. However, you know, more TAFE hands-on pathway is. We also want to put $8.4 million into literacy programs by employing 25 more literacy teachers, because we know that that is a big problem in this state. You know, when we have 49% of this state that are functionally illiterate, when Sri Lanka, a third world country, has 93%, I think it's time that we started to do something about that, because the current system is just not working. And our goal is also at the end of 6 years of being, if we do win government, is to make sure that Tasmania is at or above the national average in our plan as well. Thank you.
I'm going to try to wrap up this answer in 1 minute, because I know there's a lot more questions here. I love the TassCOSS proposal for a Learn for Your Life campaign to promote the value of education, because the biggest challenge that we're dealing with here from an education point of view is actually cultural, and it goes back many decades and in fact many generations. And it is very easy for the Liberals to say, we'll extend all high schools to colleges. That will not deal with the cultural challenges that we have in education here in Tasmania. The best investment you can make is in early years and in launching into learning. And in early years, what we're seeing come through in the NAPLAN results is that those students who've been part of that early years investments, in years 3 and 5, we are seeing the NAPLAN results improve. And it's important to remember that the ACT has exactly the same educational structure that we do, with a separation between high schools and colleges. And of course, initially I thought, oh yes, let's extend high school all the way through to college. But it's not actually that simple. We have these fantastic colleges here in Tasmania, and what they can do, because of the resources that are in them and the scale, is provide an enormous diversity of subject choices to meet the needs of a whole lot of individual students. Now, the previous Education Minister made sure that an increasing number of rural and regional high schools in Tasmania were offering year 11 and 12 courses. But I think there is a question over the future viability of the colleges if you follow the Liberals' logic and extend high school all the way through to colleges. And it is absolutely true to say that when the Liberals first put out this plan, their solution for the colleges was that they would turn them into community spaces. It is absolutely true. I saw it on the website. So we just have to be very careful about some assumptions around the Liberals' policy. On the NAHA and the NPAR, our Senator, wonderful Senator Scott Ludlam in Canberra, has been asking numerous questions in the Senate and in Senate estimates about the future of the National Partnership Agreement on Homelessness and the NAHA, and it is simply not good enough for Ms Petruisma to stand up here and blame the previous federal Labor government for its 1-year funding agreement for the NPAR, because that was agreed with all the states, and many of those states are conservative. It's not about the past, it's about what you're going to do in the future, and I'm very concerned about the National Partnership Agreement on Homelessness. I'm very concerned that the NAHA will change, and it will have strings attached to it which compromise the very viability of Housing Tasmania, because a lot of Housing Tasmania's operational budget comes from the National Affordable Housing Agreement, and it is going to make the work that Housing Tas does here with the community housing providers in the future extremely important, because it is through that partnership and working together in the face of whatever happens in Canberra and whatever happens after March 15th that will build some resilience into the system.
Thank you to the panel for coming along. My name is Sean Staunton. I'm the CEO of TassCOSS, which is the state's HIV prevention service for gay men and care and support service for people living with HIV. Obviously, my organisation works with a very specific population, and my question is, could the panel please outline their party's position on the provision of specialist community services for particular populations by organisations with specific expertise, as compared to larger mainstream services providing specialist services amongst other whole of population service delivery? I hope that made sense. It's a little bit of a windy question.
Thank you, Sean. It is a bit of a windy question. I suppose what you're asking about is specific services for a specific issue as opposed to universal services that somebody can access in the community.
Exactly.
Yeah. Be happy to talk with you about it. To be honest, as I'm not the health minister, I don't have a very comprehensive understanding of what services currently exist in the community, but particularly when it comes to an issue such as the one you represent in terms of promoting awareness and support for HIV in the community, it is in itself a very important issue we still need to discuss in Australia. There was obviously a lot of awareness campaigning around it decades ago, but that hasn't continued, and I wonder whether the prevalence of HIV/AIDS will continue to rise in Australia unless we have more public promotion around risks associated with how it's contracted and how you manage it. So I'd be happy to talk with you perhaps afterwards, Sean, if that's okay, just because I don't want to give you an answer that may mislead you or confuse the audience.
Thanks, Sean. Great question, and sort of similar to Beck, would need to talk to you further. However, the Liberal Party has announced $9 million extra funding for the community sector, which your organisation would be able to access
to give extra support. We will be releasing more health policies between now and the election, so I encourage you, if you have got a specific issue, that you do feed it into the party so that they are aware of your concerns. The other thing that I didn't actually get to touch on is that because I came from the aged care sector, I actually want to work further with this sector as well on reducing red tape and compliance reporting, because we know that ACOSS have assessed that it's about $100 million a year, that the sector spends on having to do that sort of compliance reporting. So if we can actually help to decrease red tape that you as a sector actually have to do and face every day, which works out to be about 2 months of your whole organisation's, span over a whole year. We believe that will actually help smaller organisations, especially who have to do just about as much reporting as what, like an Anglicare, for example, they don't take into consideration that you're a much smaller organisation. So we actually want to work with smaller organisations to see how we can reduce your red tape and compliance reporting so that you don't do as much work as what a multi-million-dollar community sector organisation does.
I suppose also within the question, so just to clarify, it's not specifically about HIV that I was talking about, it's more specialist services in whatever field. So do feel free to comment outside.
That's right. So I suppose what I'm saying is that any small organisation, whether you like National Disability Services, which is small, yourselves, or Why Not, for example, you all only have a couple of workers, so it's about trying to enable you to to be able to do more with the funding that you have and not have to do the same sort of compliance reporting as your bigger organisations, but also so that you can, so that we can any specific issues at all, please feed in. Thank you.
Sean, of course, we support the provision of specialised services, and we see a lot of it in Tasmania, women's services, domestic and family violence, support services, and for someone, a Tasmanian living with HIV, in fact, I would imagine that what they would wish for is a very specialised service that is not within the mainstream hospital system here in Tasmania. People need to know that there's a level of privacy, protection and discretion around them, so of course we support that. But it raises a bigger question just briefly on discrimination in Tasmania and the way people feel about themselves, the way LGBTI Tasmanians feel about themselves, and at the moment, as we know, in Tasmania, people who are LGBTIQ are not treated as equal under the law. They're not free to marry who they love. And there are 2 out of 3 people sitting at this table here who voted in support of an end to discrimination against LGBTI Tasmanians, and that discrimination flows through the whole community. So it's actually a much more rounded and complex picture than just providing a specialised service to a person who's contracted HIV.
Just touching on one issue that was raised there before about the compliance costs of the sector. I'm from TassCOSS and I've got a deal for you, because if you go to the TassCOSS website and you click on the SPP portal, Standard Performance and Pathways, you will see that we have an arrangement which is generously supported by the department, where you can do your compliance electronically, and most of those people participating are reporting around about an 80% reduction in time and cost of doing their compliance. So strongly urge you to be involved. Next question.
David Perez from the Link Youth Health Service and Headspace Hobart. And my question sort of follows a bit from Sean's, but it's a bit broad. I guess I want to get my head around the fundamental values that your party has around. We live in a very diverse state, and we know money's short. Within the sector, we see an incredible diversity of people, probably more so than the population would reflect. I want to know what your views, some of your party's values are towards maintaining a sector that in itself is diverse. I know it's really simple for government to deal with, say, 5 NGOs. So I want to know whether you're heading this to the way you see things should head, or whether you want to, or whether you can thought about the importance of maintaining diversity within a sector. And secondly to that question, how do you feel should government be competing with the sector for the delivery of some of these services?
This is one of the things that I was talking about before. It's really important that we maintain the diversity within the sector here in Tasmania. It is something that is uniquely Tasmanian, and we have to, in order to protect that diversity, make sure that the sector is having more situations like this, where everyone is in the same room, talking about what you're doing, talking about the opportunities for efficiencies and shared services, because as a greenie, of course, I believe wholly in diversity, because in diversity you build resilience, and diversity creates strength. Diversity in the community sector makes sure that you are providing a really integrated suite of community services to people here in Tasmania. The only place that I think the government should be inserting itself into community services, if you like, is where there's an identified gap that hasn't been filled by the community sector. But it should, my belief is that the government should fund the delivery of community services, because the community sector demonstrably does it way better than government.
Thanks, David, for the question. And I suppose it gets back to what I was talking about earlier, is where we actually want to shift the focus of service delivery, so it actually does allow organisations to offer diverse services, so that you're not forced to actually just chase after a grant that only permits you to actually only be able to offer mental health, for example. So we want services to be able to offer holistic 360-degree wraparound services for an individual, keeping in mind that they're going to have diverse needs. So this sort of flexible funding will allow you to deliver the best services for your sort of client, and that's why we see this essential that we have a partnership between government and the community sector, because like Cassie was saying, you deliver the services far better than what government ever can, and you also have your finger on the pulse of what is happening with your client and out in the community. So this new approach is about offering a better way that to get collective impact, but also that we can move forward together to actually make get a difference in this state, because the current system is not working, and I don't think that we should keep on trying to do what we've always done and expect different results, because it's just not happening.
Well, David, I think in a roundabout way we've got consensus on this issue. You probably need to stand on this thing. Jackie? Look, I absolutely understand what you're saying. Government has asked a lot of community sector organisations to collaborate and work together to deliver programs, because we see that there can be better efficiencies achieved that way. But that doesn't mean that we're asking you to be absorbed into another bigger organisation, and we certainly wouldn't want that to happen, because there are specific services delivered by a number of different community sector organisations where you have specific expertise, and we would not want to see that diminished or harmed in any way by requiring you to work alongside someone if you thought that would be to the detriment of your ability to deliver a service. We will probably continue to ask you to work together, because I think, as we've outlined, it brings about the best outcome for the community when we work with you and you all work together and we all work as one for the best outcomes. But certainly those specific responses in particular areas need to be respected and continue to be funded individually. And, you know, as my colleagues mentioned as well, I suppose when government intervenes, it's where there is a gap. And I would not like to see government stepping into those spaces where the community sector is already working effectively, providing those services to the community, and I certainly would endorse that approach.
Thank you. My name is Jan Smith. I'm the CEO from the Alcohol, Tobacco and Drugs Council here in Tasmania. Now, we know that the rates of alcohol, tobacco and drug use in Tasmania are significant, and there are significant harms that are caused by the use. For example, we have 21.8% of adults who smoke daily. We have about 50% of adults who consume alcohol to a harmful level, which is more than 4 standard drinks at any one occasion, and around 12% of people over 14 years of age who report using illicit drugs within the last 12 months. So what I'd like to know is, we haven't heard a great deal about the three parties' policies in terms of their approach and their position in terms of tackling the harm that's caused by alcohol and other drugs. But also I'd be really interested in hearing as to whether you're actually in support of the principle that underlies the Tasmanian drug strategy, which is harm minimisation, because there is a lot of talk these days around personal responsibility and the choices that people make in terms of their drug use. And also, we've talked a little about, we've heard you talk about stigma and discrimination. And what I'd like to know is that in the development of all policies, whether they be around corrections, whether they be about sentencing or any type of issue that is a social issue, will those policies actually be aimed at reducing stigma and discrimination against people who use and have substance dependence?
I guess to start off with, yes, I do support the harm minimisation approach when it concerns drug and alcohol use. In our community, it's a position the Labor Party holds strongly, and we're also very supportive of a restorative justice approach when it comes to these types of issues. We don't support mandatory minimum sentences for breaches of the law as it stands, so to speak. We believe there are a range of underlying issues that are often at play when we're talking about people who have alcohol or drug dependency. My personal view is that I would like to see more funding into the early intervention and prevention programs that we can offer as a state, because I believe they not only help that person and that family, but it also costs the government less money, because when they're not reacting at the other end, where you might have a domestic violence issue or a child going into the child protection system. As a member of the Child Protection Committee, as was Jackie, we heard a lot of evidence regarding the causes, I guess, in the dysfunction in families, and a lot of the time it was addiction, whether it be to alcohol, drugs, gambling, a range of different things, and the dependency that created and the dysfunction that then flowed through to that family. So my personal view would be that we invest more money in those early intervention prevention programs, whether it be around awareness campaigns to make people understand the risks of that type of behaviour. Our health policy is yet to be announced, and so watch this space. But hopefully that covers off the question.
Thanks for the question. And like Beck was saying, our health policy, which does touch on the areas that you mentioned today, is still to be announced. So all I can say is watch out for it. It'll be on the website, so just keep on looking at it. But if we just look at the approach that I've been talking about today, having an outcomes focused, your service, we believe, would be crucial as part of the whole mix here, of actually tackling, what we're talking about, disadvantage and discrimination, because, I know when I go with like organisations like Louis Band, etc., it's the people who are homeless or drug and alcohol, etc., that, people will just walk by on the street and try and ignore and try not to smell. So I 100% believe that we need to decrease the discrimination against these people, but I believe this is where we also need joined up services, so that one caseworker can work with that problem in their drug and alcohol problems, as well as their homeless problems, as well as their mental health issues, get them the counselling services, bring in specialised services when required, so that person gets a 360-degree, looked after at 360 degrees, instead of being their drug and alcohol problem being separate to their mental health, to their homeless sort of issue. I think that, like Mick was saying, early intervention is crucial. Like, I'm a registered nurse, and I've known for working in casualty, etc., that the trouble is, by the time that people usually get to an A&E clinic or something, it's a lot of years down the track before they're found at where they are. So we need to get early intervention services in earlier to try and get these people housed, look at their mental health issues as well as their drug and alcohol. And it's all going to start a lot earlier than what it's happening now. But it also needs to be part of an integrated, holistic sort of service system.
We've got a bit of consensus here. When my son was 15, and I knew he'd be thinking about smoking pot, I got the paper that was produced by the University of Dunedin in New Zealand, which talked about the link between mental health challenges and early use of marijuana. And I said, you'll make your own choices, but read this first. Anyway, he's just graduated from university with a high distinction average and has the occasional beer, but he's a really good boy. So the point there is that if you can engage with young people about the risks associated with a whole range of substance use. And I do believe that alcohol is the most harmful substance that's freely available in Australia today. If you can get into schools and talk to young people about the growing brain and the importance of protecting the neurons, I think that you can make a really substantial difference. People who have substance abuse problems have often had very difficult childhoods, so that's where the whole integrated family support structures and community supports are really important. People who have substance abuse problems are often living in poverty, along with their mental health challenges, and as Jackie and Greta have said, there's housing issues, and of course there's a lot of despair that comes with not having adequate affordable housing, feeling undereducated, not having a job, or not having a job that makes you happy. So this is actually a systemic, societal, a whole of society issue that we're dealing with here, and Australian cultural attitudes towards binge drinking. It's not just a Tasmania-specific problem, but we do need to treat this as a health issue. The Greens have always supported a harm minimisation approach, and we have always been passionate advocates for looking at each individual as a person of worth, who is worth investing in, and examining all the complexities of the issues that brought them to this place in their lives, where they're sticking their money into tobacco or alcohol, or one of the biggest social cancers that we have in Tasmania today, which is poker machines, which is another part of that addictive behaviour that we're dealing with. So if you do what TassCOSS has been talking about for a very long time, and you tackle the root causes of poverty, you invest in housing, education, and a society that nurtures young people and in fact values all people, then I think that you will deal with some of those individual issues that lead people to addictive behaviours.
Yes, good morning. Dan English from Royal Guide Dogs Tasmania. We've heard a lot about the travails of the Tasmanian economy and the impacts that that's having on our various organisations in terms of funding. We've heard very little about the fact that most services are in some way, either to a lesser or greater extent, subsidised considerably through the efforts of philanthropy. I'd like to know the various positions that you have on promoting philanthropy and making sure that philanthropy remains a very strong part of the sector, because without philanthropy, many of the services here would not be able to continue, and unless you have a structured policy to actually increase the contribution of philanthropy to many of our organisations, many of us will not be able to continue.
Thanks, Dan. It's really interesting you raise this, because probably the last 6 to 12 months, the Premier and myself, when I was acting as Cost of Living Secretary, we're talking about how we engage the private sector in delivery of programs that are currently funded only by the government and the community sector. Obviously, as a community, it's everybody's concern what happens here in our society and in our state. So we've started a range of discussions talking about exactly this, about how we can engage the private sector into what we deliver on the ground in the community sector space. So it's something I'm very keen to continue discussing with the private sector, very supportive of any philanthropic effort that's made to support the community sector here in Tasmania. Fully understand the importance it has in terms of supporting Royal Guide Dogs, but also a range of different organisations in this room, and certainly happy to discuss with you how government might be able to assist with that.
Thanks, Dan. It's a great question, because we know that with health and human services, that the money that we need to spend on that in the future is going to be bigger than the whole state budget. So we do need to bring into play that partnership between community, government and the private sector. So towards that end, I have been holding round tables over the last 4 years where I've deliberately invited business leaders along with the community sector organisations so that we can start up relationships, because we need to start those conversations off with the business, because if the business sector realises by investing in your sector, you can actually assist them in, if we work together, we can achieve the outcomes to actually move Tasmanians out of entrenched disadvantage into the workforce, so they don't feel the need, for example, to have to bring in people from the mainland to get jobs, and I see that this is a partnership that needs to happen where the community, government and the private sector works together. It's also in education we need to work together. It's, philanthropy, like you were saying, is to get those dollars invested into your organisation so that they don't not only get a feel-good effect, but they actually see that it does achieve better social outcomes in Tasmania as well. So,
Agreed. Of course, the sector will need to work with private enterprise because, as we've all agreed here today, the pool of available funding is not going to grow, but the needs, demand for services will continue to grow. Corporations generally are very willing to give, particularly to people-focused endeavours, so I think there's a lot of space there. What you need to make sure is the case, though, is that any effort that a community sector organisation makes to secure, off its own initiative, philanthropic donations doesn't compromise the funding you already get from government. So it has to be a reward for effort rather than something that allows government to diminish what it gives to you. So that's something that you can work through the partnership agreement that is in place with government now and the Peaks network to make sure that there's a recognition there that if you secure generous funds from private benefactors, that that's extra money you can put towards service delivery.
This will be our last question.
Just a really quick one. Deborah Byrne from the Brain Injury Association. Some time ago when David Bartlett was Premier, there was front page news and was also in the media where he brought together 200 of the best and brightest minds in the state and in the public service, yet we've continued to see innumerable consultations done by quite often external consultants at considerable cost, which has kept many of us very busy in the sector quite often to no outcomes, and perhaps a really good example of that would be the Peaks Review. So just out of curiosity, I'm just wondering what your policies are on the use of external consultants in moving forward if you were to be elected.
Excellent question, Deb. The Peaks Review, I'll just start there. The Peaks Review, which was a very worthwhile body of work, happened to collide with the budget crisis in Tasmania. So the Peaks Review is sitting there in Never Land, really, at the moment, and I know it's something that is a regret, certainly in the Department of Health and Human Services. On the use of consultants, there is an argument that government can overuse consultants, but I don't think we want to move away from their capacity to use them from time to time. And one of the best examples I think of where the work of a consultancy was really effective was in the review of specialist homelessness services in Tasmania, where we developed the Housing Connect model, which is that single integrated access point for anyone looking for housing support from homelessness through to home ownership. So there's a balance here, really, because I don't think departments always have the expertise to find a best practice model, and I don't know that departments are always the best at consulting across the diversity of the sector. So I think it's a partnership between the departments often and consultancies, but there have been times when I have thought that a consultancy that we engaged was a little expensive, and we've tried to trim it. But just before I leave the stage, I just want to talk, because I think this is an area that will be of particular interest to you and the Brain Injury Association of Tasmania. In 1 hour, I will be announcing our disability employment strategy, which is a $2.5 million investment to, over the next 4 years, harness the capacity of all those people with a whole range of abilities who are willing and able to work. And the great vehicle that is allowing us to do this now as a state is the National Disability Insurance Scheme, which will provide people with that level of support that they need to go out there and get the extra education, training and employment opportunities that they need. Graham Innes, the Disability Discrimination Commissioner, has said the foremost empowering words you can say to a person are, you start on Monday. The biggest barrier that people living with a disability have to employment is in attitudes from employers, but also I think there's a real space here for government to provide more work experience opportunities and more employment opportunities for people living with a disability, and show some leadership in that space, because at the moment there are so many bright young things in Tasmania who are burning to work, and we haven't as a community harnessed that potential, and it's a terrible waste of individual capacity, and it's also harmful to our productivity as a state. So I'd like to think that no matter what happens after March 15, that we can all commit to making sure that people living with an intellectual or physical disability and acquired brain injury can also find work in the Tasmanian community and give and contribute as they wish to do.
Thanks, Deb. I'm really glad you actually did ask that question because for the last year, since May last year when we put out our alternative budget, near the back page, which is available online, has actually outlined our nearly $500 million worth of alternative budget savings. So it is a matter of public record. And if you go to the end of our Plan for a Brighter Future, which was our alternative budget, you'll actually see there listed our savings initiatives. And one of the savings initiatives is to reduce spending on boards and committees, which will save us $9.5 million a year. Another one was to reduce supplies and consumables and consultants, which would save us another $74 million a year. Now, part of the reason why we've announced that the $250,000 would go to TassCOSS is that I passionately believe that we should not be outsourcing these things to organisations on the mainland, that we have got enough intelligence and intellectual capacity in this state to come up with a Tassie-based solution. And that is why we thought that TassCOSS, as your pick, be the best one to represent your interests instead of bringing on board another consultant to help us to drive this new way forward, because we very much believe that you people are the ones who actually know what is needed for Tasmania, not an organisation from the mainland that's never lived in the state or worked in the state. So we are passionate about making sure that boards, committees and consultants is decreased, because I'd rather see that money go out to frontline services such as the ones that you are delivering.
Thanks for the question, Deborah. I know that, the time that I've been Minister for Human Services, the work that we've done has predominantly been conducted internally or with the assistance of the peaks. And across government, the money that we spend on consultants has decreased substantially since we faced this type of budget situation. There are times when you have to get expert advice if you want to find out exactly the best way to deal with an issue, and I don't think, therefore, I could ever rule out never going out to the market to engage the right person to do the job that you need. I think it's really important that we don't limit ourselves and don't limit the expertise that we as government, that in terms of controlling and running the state's budget, limit the amount of expertise and the intelligence that we can get to help us provide the best answers for the use of public resources and funding. Certainly, respect the point that people have made in the past that government spend a lot of money on consultants when we've got perfectly intelligent people within the department who can perform those tasks. And we have been looking to them more and more to do that because of the fact we haven't had the surpluses that we would have otherwise had in the past to perform that work and outsource it. So, respect what you're saying, but I think at times you need to get the best advice to get the best solutions. In respect to Jackie's last comment that the Liberals would save $74 million by cutting consultancies, boards and committees, they still haven't articulated exactly which boards and committees they mean or which consultants programs they would cut in terms of the programs that are delivered across government. I think it's still very hazy. Boards and committees, obviously we have many of them, they represent and provide excellent advice to government across a range of different areas, and we rely on that advice because that's how government consults with the community, consults with business, it consults across industry so that we can develop the most appropriate policy to provide the best outcomes for Tasmanians and the best spend the Tasmanian taxpayer dollar. So I think it's particularly hazy. Don't be swayed by that win line. I would like to take the opportunity with the last question, Tony, to thank you all very much for the questions that we've had today. I think it's been a good discussion, and of course we'll be around for a little bit afterwards if there's anything in particular that you would like to raise in addition to the questions we've had already. Thank you.
Thank you, Beck, and yes, they were very good questions, and I think it allowed us to actually hear a lot more information about the diversity of issues going on in the sector and how some organisations are dealing with those and the sort of support they're looking for to enable them to continue to deal with those in the future. So I'll wrap things up now, but I particularly want to thank, on behalf of TassCOSS, the key financial supporter organisations supporting our campaign, all of whom are represented in the room here today, and our Tasmanian community sector peak organisations for their great support of the campaign and making these sorts of events able to be held in this way. I'd like to thank all of you for coming along today and for the excellent questions and making this forum, I think, a very good exchange of information in so many ways. But in particular, we wrap up by thanking our principal speakers today, Beck White, Jackie Petrusa and Cassie O'Connor.